Hi everyone, Dinesh Sarasena here, and today we're going to be talking about imaging the quadriceps tendon of the knee. As with my previous talks, I recommend two resources. Firstly, the ESSR guidelines for musculoskeletal imaging, and in this case, the knee guidelines. And second of all, ultrasoundcases.info. And here's the images from the ESSR guidelines. With the patient in a supine position, you place the transducer in a long axis orientation above the patella. In this situation, you will see the quadriceps tendon beneath with the prefemoral fat pad and the bursa. The quadriceps tendon should have a linear structure and should be continuous and attach on to the patella tendon. In some situations, you may see an enthesiophyte, or there may be a hypoechogenic change which represents a tear. In the long axis orientation, it's also important to scan from medial to lateral so that you see the tendon in its entirety. Having assessed the tendon in the long axis orientation, it's important to turn the transducer 90 degrees so that you can assess the quadriceps tendon in a short axis orientation. In this view, you should scan from proximal to distal to make sure that the tendon is intact and there isn't any significant fiber disruption. And this is how I would typically orientate the patient. So having the patient supine, I might use a support to keep the knee in a flexed position. It means that the patient will be a lot more comfortable, that your images will be a lot more stable, and you will be able to assess what's going on more readily. And this is what it's like when you're scanning. So keeping the transducer either in a short or long axis orientation, depending on how you're assessing the tendon. Remember, as I said earlier, it's important to scan through the tendon from proximal to distal or medial to lateral to make sure that you assess it fully. And this is what you will see on the ultrasound. So again, in the long axis orientation, you will see a portion of the patella where the quadriceps tendon attaches onto. You will see the fat pads and the bursa, and you will also see the femur. In the short axis orientation, you should see the quadriceps tendon in its entirety, maybe with a portion of the bursa sitting beneath it, and you may see portions of the vastus medialis or the vastus lateralis, depending on how proximal or distal you have positioned your transducer. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.